my name is Megan, and I am the clinician, and I am here with my patient, Destiny. So Destiny is 50 years old, and her profession is being a stockbroker. So she works very long days and nights, so she has limited time for her home hygiene care and for proper eating. We just took her blood pressure, and it was 130/85. Her beats per minute was 90, and respiration was 18. Periodontal risk assessment, she has underlying health issues, diagnosed with scurvy, which is a vitamin C deficiency. Her bleeding on probing was 50% generalized, probing depth generalized between 5 to 6 millimeter pockets, and she has less than 6 teeth in quadrants 1 and 2 with generalized bone loss radiographically at 15% with slight furcation involvement on number 19 and 30. Caries risk assessment, she has only eats soft cariogenic foods. This is due to her loose teeth at the bottom, and only drinks bottled water, so that's limited fluoride intake. Health history assessment, she is diagnosed with vitamin C deficiency scurvy. She does eat a lot of soft foods that includes cookies, bread, beef, milk, eggs, and grits. Her mandibular teeth 23 to 26 or slightly mobile, and right now she has easily bruised skin, and she has some non-healing wounds on her arms, interproximal caries, bleeding gums, and scaly skin around her commissures and nose. I did go ahead and give our patient the food diary, and so she went ahead and circled all the sugar. So you can show them the little food diary that we have here. Perfect. All right, Destiny, so I had you go and circle everything that you said that you thought had sugar in it, right? Mm-hmm. Okay, so at the end afterwards, we're gonna go ahead and talk about your acid timing. So with your acid timing, it is 20 minutes after you have any sugary or acidic drinks, and then it's 40 minutes after any food that you drink or eat that has any soft or solid food at all. So after we did that, we kind of went through each day. So I have it down over here. Yes, so after the first day, it was 400 minutes, day 2 was 360, and then day 2 was 220 minutes. So the daily or the average for all 3 days of your acid attack was 326 minutes, which is around 5 hours. So this is every day for 5 hours a day, you have acid attacking your teeth, and you're not disrupting that with a neutral pH. Mm-hmm. So just swishing water in your mouth after you eat, or just drinking a glass of water can hit your pH levels back to normal, so that we can decrease the risk of cavities in your mouth. So with that being said, I do have a couple of diet change recommendations that we can talk about. Mm-hmm. So I would suggest that you switch over to tap water, because this will maximize your fluoride intake. Since you do have some interproximal lesions on your teeth right now, and you only drink bottled water, this will help kind of regulate that. And I would also recommend you switching to drinks like milk or tea and water, since the pH level is around 6 to 7. Instead of doing like from the food diary, we had a lot of orange juice and we had Coca-Cola, and those are very, very acidic, and it starts to demineralize your teeth. You can also limit the amount of snacking throughout the day, or replace the snacking with healthier foods like fruits and vegetables, especially because you do have a vitamin C deficiency. We want to make sure that you're doubling your vitamin C, because you don't make as much as the average person. So we need to make sure that you're having a lot of vitamin C in your diet to ensure that, and then also your side effects will change too. So your bleeding gums, your loose teeth, your scaly skin and bruising skin, that will help too if you increase your vitamin C. With options for vitamin C that are also low in acid, you can have red bell peppers, broccoli, kale, raspberry, spinach, and potatoes, zucchini, blueberries, and bananas, and that's just a few things. There are so many things out there that have a lot of vitamin C that are low in acidic for your teeth. Okay, so with that, I would have 2 goals for you. The first goal I would say is just to limit your cariogenic foods and drink, and replace those foods with high vitamin C and neutral pH foods. And then goal 2, I would say limit your snacking, or replace the snacks with fruits and vegetables, and drink water after eating acidic items. So with that being said, is there any questions you have, or is there any on the diet change recommendations? Is there something that you're willing to do or not willing to do?
Yeah, so I'm willing to replace my snacks, and I'm also willing to switch to tap water. I'm not sure that I can commit to that fully, but I'm willing to work on it. And I do have 2 questions for you. So my first one is to be like, I'm of age, why should I learn about caries?
About caries? Okay, so when you get decay on a tooth and you leave it unattended, the decay starts to continue and get worse. This can then furthermore cause a lot of pain, and major restorative procedures do cost a lot of money. Having balanced meals with neutral pH allows the mouth to not have that acidic environment for a long time, and it allows the bacteria to not linger and thrive in it and to continue to grow and break down your teeth. So this will help prevent the cavities from forming, so it will help save a lot of money and save you some pain in the future.
Okay. Well, I have another question. This is, with my time, how do I manage having a healthy balanced meal with my busy working schedule? And then I also have a scurvy, so how would I do that?
Okay, yeah, of course. So I know that you're really busy, so at the beginning of each week, I would say go to the grocery store and meal plan. There are so many easy, cheap, and efficient recipes online that you can look, and especially for vitamin C recipes. You go to the store, you can even do the pickup for the stores, and you just go and you meal plan for the whole week. So you can cook a huge portion and kind of pack it up for the entire week. So when you get home from long nights, you can just go in the refrigerator, open up a pre-meal package that you made personally, and it has all the nutrients that you need. Also, if you do go for times that you just are running late and you go to the restaurants, there are a lot of options like salads, and they have fruits and vegetables and grilled items that can also be high in vitamin C and low in acidic foods.
Okay.
So we did go ahead and put in the clinical documentation and her treatment plan. Planned interventions for D1310 for nutritional guidance is also listed in the patient's dental chart. We did have the 2 goals: limit cardiogenic foods and drinks, and to limit snacking or replace snacking with foods and drinks. All right, Destiny, before you leave, we're gonna go over your nutritional counseling summary real fast. Okay, so with your vitamin C deficiency and you do have interproximal lesions, I would say that your caries risk is high. You do have moderate perio disease, and with your poor nutritional diet, it does you're going to be experiencing weight gain. So we're going to go ahead and fix that, okay? So I had the 2 goals: limit cardiogenic foods and drinks, and replace the cardiogenic foods with high vitamin C and neutral pH as well. Then we're also going to try to limit snacking or replace the snacks with fruits and vegetables, or just drink water after you eat or drink anything that's acidic. So overall, for breakfast, lunch, dinner, snacks, and beverages, you're eating a lot of processed food, eating a lot of bread. And I know it's because of the salt or the loose maybe of their teeth, but if you do eat any like crunchy things like celery, carrots, you could try to use your back molars instead, because I know that it hurts at the front here for you, and just swishing the water out in between. You're also eating very acidic foods as well. So like I said, just rinsing your mouth with water after you eat or drink anything will help neutralize your pH in your entire mouth. And then with just recommendations, there are so many things you can do. Like you can make smoothies that has high vitamin C with strawberries and raspberries and mangoes. Pretty much any fruit out there is really good with vitamin C. And this will also help with your deficiency, and then it will decrease your risk for cavities on your teeth. So yes, there's also other things like broccoli salad, a lot of soups with chicken broths, lamb is really good, rice is good, sweet potato like chili is really good. Just eating a lot of vitamin C rich foods that are low in acidic will really, really help not only your deficiency in symptoms, but it will help your oral health as well.